Let's dive into the hydrant movement. I'm Dr. Nichelle and I'm specialized in prenatal and postnatal movement. The hydrant can be a great movement to start working on more stabilization of the pelvis, specifically utilizing the glute med, which is what I call the side butt muscle. The glute med is one that is going to be really helpful for helping with pelvic stabilization. So for the hydrant, you're going to come down onto all fours. You're going to make sure your shoulders are stacked over your wrists, your hips are stacked over your knees, and you're just going to be bringing your knee out to the side. If you're having a hard time with balance, the other knee that's not moving or leg that's working, drive in a little bit more to midline and then bring that leg out. Sometimes it can be hard during pregnancy to maintain that balance in this position without shifting that stabilization leg on the ground. And you're just going to come out to the side. Breath pattern you can do would be inhaling at the bottom, exhale, drive up. The area that I'd like you to also focus on for your core is going to be your abdominal wall in this position, especially if you're farther along, like in third trimester. Think about your pubic bone coming up towards your belly button as you are lifting your leg. And that will just help with a greater core stabilization as you lift that leg. So I'm going to inhale, lift my lower belly, and then slowly lower back down. Again, I started off a little bit wider. If you find you try that and you're off balance, bring that stance leg or knee in, and then repeat that hydrant. If it's hard to get onto the ground, you can absolutely do this up towards a wall. So you lean against your wall or your counter, create an incline. Make sure you're in a nice line here. You don't want to be bulging butt out or dipping in, so nice straight line. And then same thing, where you might bring that leg a little bit more midline than being out, just for balance. And then same thing with that hydrant. Still making sure as you bring that leg up, you are scooping that lower belly to engage the abdomen, to engage that part of your core. So you can do hydrants on the ground, or you can do it leaned up against a wall or a counter.